If you talk to anyone, everyone has a personal story about cancer. Either themselves they are affected, or one of their family members, or one of their team members, someone is affected by cancer. There is no family that is spared by cancer. What we want to do is that make cancer as a chronic disease like diabetes or a hypercholesterolemia, so that the patients can live as long as they are likely to live in a normal environment.
At the UT Health Science Cancer Center, researchers are trying to do just that, while training the next generation of researchers and medical doctors. Research and the training of the next generation is where Dr. Ramesh Narayanan comes in.
Cancer is something that just goes on, like say, uncontrollable. And when you start hitting it with drugs, it always finds an escape route. It doesn't like to be inhibited. So it's almost like I can say a very tantrum throwing child. Like if you make this child sit in a corner, the child is not going to, after a couple of minutes, he or she is going to just start throwing tantrum again. So that is how the cancer is.
Meet Sarah Asesmota, who studied with Dr. Narayanan, earning her PhD, and now is a UTHSC third-year medical student who wants to help more women survive breast cancer.
Cancer is this umbrella term that we use to describe multiple disease processes. So breast cancer is not the same disease as colon cancer. We just call it all cancer because that's easier and that's colloquial, but in general, these two things are completely different diseases. So there's never gonna just be one cure, because I wouldn't use the same medicine to treat something in the pancreas as I would use to treat something in the brain. Even more now that I've done this research, there probably will never be a one-size-fits-all, because cancer is really smart. It's the same way that bacteria gets resistant to antibacterials and things like that. We've all heard of MRSA and all that stuff, right? Well, cancer does the same thing. You can treat it with something for a long time and the cells change, they mutate, and they are now resistant to that form of treatment, and it comes back and it grows. And I know anybody that's dealt with cancer themselves understands that scary moment each time that they go into the doctor of whether or not the cancer's come back.
But that doesn't mean there isn't hope.
There are a lot of cancers that have become more chronic. There are some cancers where patients live for 35, 40 years after their initial diagnosis, and they die of natural causes, not by cancer. But on the flip side, there are some cancers that just go really robustly fast, and then it just kills the patient. So it is important, like say, preventive measures are very important, and early diagnosis is very important. But it's a really very puzzling disease. Can cancer be cured is what is in everyone's mind. Can it be a curable disease? Maybe in some cases, but in majority of the cases, we are actually thinking that it's a more manageable disease, unless in a small sector of unfortunate cases where it's not manageable.
It just takes funding.
Resources is the starting point of any research. Once we have the resources, then we can go ahead and test all our hypotheses and all our drugs and all our different ideas and see if they're all working. Not every idea or not every hypothesis, as I mentioned before, will be successful, but even one of them succeed, then that just changes something.
At the end of the day, nothing can be done without money. All these labs in this building or any other building, they're all vying for grants, any type of funding to help push them through to the next day. And the crazy experiments that even the ones that I was able to do in Ramesh's lab, that cost tens of thousands of dollars, that stuff is not even attainable to smaller labs because of the sheer cost of it all. Obviously cancer affects everybody. Lots of diseases affect a lot of people. And it's always about who's willing to give money and or how are we going to get the grants or any of those things in order to push research forward.
Whatever we do has to go back to the taxpayers in terms of a benefit, in terms of a knowledge or a drug or a diagnostic or something. It has to go back.
That's just one lesson that Dr. Narayanan tries to pass along to his students as he mentors them and prepares them to move into other research labs.
So a successful mentorship is my students just going on to do something amazing. And one day when I see my student a better scientist and a better leader than myself, that would be the most gratifying day for me.
For the University of Tennessee, this is Charles Kemp.
And Jennifer Sicking.